Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in. Today we're scheduled to have Dr. James Barber with us. Had a little difficulty raising him ahead of time. He's a Pittsburgh doctor, should be easy to get, and he was not. We're going to continue to try, however, but you know, as we can do so well around here, if we're going to switch gears, I'll let you know, and we'll take off and move down a just familiar path. We'll open it up to you then, the listener, to set the agenda in what might become a conventional, traditional, get 'em up, out of town version of the show. So we'll know right after that first break. Dr. Barber may just have been indisposed, but if he was not and just has forgotten about the whole thing, we'll take it from there, and I'll let you know to give us a call. You know that number, of course, whether Dr. Barber comes aboard or not today. And we're going to talk about cancer screening. There's a neat genetic test, actually insurance covered. I promise you, if we don't get to the discussion today, we will bring it back because it's an important topic. Many of you are concerned with familial history as to whether you carry the proclivity to developing these cancers, and now that sophisticated testing is available, it's on my radar screen. I know it's on yours. I'll bring it back to you if we have to. Now, this month is shaping up. It's a hot month. We're in Top Doc Summer. As you well know by now, the top 20 alternative doctors of America met in Phoenix, Arizona a few weeks ago, 3 or 4 weeks ago now. And at that time, each of the 20 top docs wrote a chapter to a book. The book, by the way, is available. I'll give you information on how to get that. There are so few copies. Actually, there are 2 in the whole city of Pittsburgh. But be that as it may, I hopefully will be able to bring to you all 20 of the top docs. I plan to do so over the entire summer, and the month of June has been the launch. Of course, on the 9th, we had Dr. Carl Robinson, a really fascinating discussion of homeopathy, and I really enjoyed it. On Wednesday, we had Dr. Michael Margolis. Now, he's a dentist. He's a biological dentist, and I really enjoyed revisiting that topic on the dentistry issue. There are a couple things I'll bring to your attention in a moment. I thought that were new with Dr. Margolis, and if I have some time, and who knows, I may have the entire program, I'm going to reflect on that because many of you are requesting dental procedures done. I will assist you in getting to the right person to get them done, but the new materials are affording you opportunities you never had before. I'll point those out to you. Now, on Monday, Dr. Mark Starr is going to be our guest, another one of the top 20 docs. Dr. Starr is a internal medicine doctor who's been pretty much profoundly interested in thyroid disease. He has been a disciple of the great Rhoda Barnes. And by the way, Rhoda is the name of a male doctor. I always thought it was a woman. It's not. Dr. Rhoda Barnes has since expired, but his research and his work in the area of thyroid is unheralded and unmatched by any other physician, at least that I've been able to read from. And with the information that he was able to gather from Dr. Rhoda Barnes' library, there's a whole host of great things that can be done. How about this one? Preventing heart attacks, preventing heart failure, and preventing diabetes. That, by the way, is the title of Dr. Mark Starr's new book, and all to be accomplished through the use of thyroid hormone. another role for thyroid hormone. You don't want to miss it on Monday, especially men. Men who come to visit me, thyroid hormone is going to be top of my agenda, and you'll understand better about this on Monday. Then next Wednesday, Dr. Lee Cowden is going to be here. He is a board-certified cardiologist. We probably won't talk. Well, no, I can't say that. I'm very interested in running some cardiovascular things by a great cardiologist such as he. But his presentation at the Top Doc Conference was on the various cancer treatments out there, and he covered them all. And I think that's a very nice and sweeping discussion to have. We'll have it with Dr. Cowden on next Wednesday, which is the 18th. Now, for those of you who on the third Thursday of a month are looking for a place to go, and I know you're out there, and I'm talking about the Freedom of Choice in Cancer Therapy group, who gets a chance every third Thursday to meet up. And, of course, as you well know, they take off for the summer. Came to the point where they didn't have a guest or a speaker because Dr. Boyd Haley couldn't make it. Dr. Schallenberger is going to have to wait until the fall. And so it's going to be yours truly out there on Thursday evening. Come on out. I intend to cover a topic initially presented. I checked the dates. This dates way back to 2004, 2005. The lecture at that time was a breakthrough lecture. I entitled it The 7 Deadly Sins of Conventional Medicine. And so on Thursday night, I'm going to revisit, and that's the name of this particular presentation, The 7 Deadly Sins of Conventional Medicine Revisited. We'll take a trip down memory lane, but we'll tack onto it all that has happened new since 2005, 2004, 2005. I think it'll be an interesting evening. I promise to talk also about ozone therapy. It is changing my medical practice around. People are beating down this door. They have all sorts of problems. They know ozone is a unique enough therapy. They all want to try it. I, by the way, will spend next Friday as, we'll call it I Love Me Testimonial Day, okay, because having some great success, I wanted these patients to come on board to the show and talk about their success, how they're doing with ozone therapy. I think it's a great thing for you, the listener, to pick up on. You hear me talk about it. You hear Frank talk about it. How about patients who are suffering from Lord knows what for taking ozone therapy and doing extremely well? So Thursday night, Freedom of Choice in Cancer Therapy Group. And as I say, 7 Deadly Sins Revisited, Ozone Express discussed, iProgram explained. What else is there? I'll be happy to, by the way, answer any questions from the audience as I normally do. We should have a good time. See you on Thursday night. Then the following week, Bruce Shelton will be my top doc guest. He is a practicing physician in Phoenix, Arizona, and he is a homeopathist, a very proud homeopathist besides being a medical doctor. He'll also spend some time with us talking about homeopathy and some neat remedies that he himself has put together through a company called DesBio. And these are remedies to help you in some predicaments that I know you've brought to my attention before. And things like the vaccines, radiation, all these things have homeopathic remedies. We'll ask Dr. Shelton to discuss them. On the 25th of the month, the bad boy, the West Coast bad boy, Dr. David Steenbach. I say that with all due respect. He is a maverick. He stands tall. He has been assaulted by every governmental agency and medical board wherever he has hung a shingle, but he continues to persevere, and he is now working with stem cells, a fascinating topic. We'll discuss that with David Steenbach. He'll be my guest on the 25th. On the 27th, to round out the month, pretty much, we're going to launch a new product line here. For those of you who have either have weight concerns, weight issues, are pre-diabetic, or just are full-blown diabetic, there's a neat line of products to help you curtail your blood sugars in a way you can't have done before, using thermogenic coffees and teas. The name of the company line is called Beresha. So I'll be introducing you to Dr. Angelo Mitsos. He's a doctor, a podiatrist from Newcastle, and we'll be launching that program. We're going to have a tasting event here in my office if you want to be involved on the 9th of July in the evening at 6 o'clock. So you'll hear me talking about that more and more as time moves on. Anyway, is that enough for you? How are we doing for the month of June? And we actually still have one final date, the 30th. I will fill before we flip the page in the month of July. Looking way out to that point, Nicholas Meyer, another top doc, a dentist, will be with us in July on the 14th. But there'll be plenty of guests between now and then. And that's my story, and I'm sticking to it. So let's do this. I'm going to take a short break. In the interim, we're going to see if we can locate our Dr. James Barber this morning. I'll keep my fingers crossed. Either way, I'll let you know which way we're going. We may have to switch a gear, and if we do, we may open it up to you for Open Phone Friday. Just hang loose. I'll let you know which direction we're moving upon our return. Be right back.
Tired, stressed, you turn.
I just got the voicemail. Is that what you got?
Yeah, that's what I got. Okay, we're switching gears.
Okay, you want me to keep trying?
You can give him another try, and but I just don't think that's his home, for God's sake. Where in the hell is it?
Yeah, I was going to say it's a home number.
Yeah. So hey,
all right,
we will switch.
Yeah, unless he, had to rush out for some reason. So, all right, I'll double beep you if I have to get him before the next break.
Thank you very much.
Okay.
Best for you. Call 412.
Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9. I'm Dr. Dennis Courtney with you today on a Friday morning version of the show, and I have now declared it to be a get 'em up out of time, but we're switching gears, folks. We'll get a hold of Jimmy Barber and bring him back talking about this very important topic of cancer pre-screening testing. We just won't do it today. And we're now opening it up to you. If you got a mind to come on in here, enough guests are coming on my show that may have created some questions. I intend to talk about a couple of those things that even interested me. I'll emphasize those to you in just a moment. But you know how it works. Give us a call by dialing us up at 412-825-6262. That's 412-825-6262. And, of course, I'll listen for the knock on the door, and I will let you in the store. Now, wanted to mention a couple of things. Our previous guests keep on coming at you with such powerful information. I oftentimes wish, I wish we could spend 2 or 3 shows on each and every one of the doctors. But let's just take Michael Margolis, the gentleman I had on my show on Wednesday, the biological dentist. I know I got great feedback from my patients who had heard the show, and of course I invite all of you to go listen to the show if you missed it by heading to my website at djcmd.com. That's djcmd.com. On the opening page, you'll see an icon marked Archives. Click on Archives. You're taken right to YouTube, and all of my shows since 2003 are there. Scroll to June 11th, 2014, and you'll be able to enjoy Dr. Michael Margolis either again or for the first time. Now, one of the things that I thought was interesting with him, two particular issues that I know I've already used since I had my discussions with him. First was on his website, which is mydentistaz.com. My Dentist, and the AZ is for Arizona, folks. That's where he is. mydentistaz.com. On the opening page, just scroll down to the bottom, and there is a meridian chart you can click onto. I thought it was fascinating because what you are presented with is a diagram of the mouth, both the upper and lower teeth, and then each one of the teeth are numbered, and then depending on which tooth you click onto, it gives you, pops up, a menu pops up and gives you all of the organs and body parts and body mechanics that run through that tooth at that meridian. I was just fascinated by the fact that I had a patient in my office yesterday, and I went to that chart because she had a root canal on tooth number 30. And it just happened to come out toward the end of our discussion, and lo and behold, the right-sided root canal has led to a whole host of right-sided symptoms. Abdominal pain, constipation, pelvic congestion, right ear hearing difficulties, visual disturbances, headaches on the right side. Everything was right-sided, and so her mouth sort of dropped whenever we looked at the meridian, and every single organ that she had a complaint with was represented on that by clicking on tooth number 30. In her case, consequently, because we looked at that. And you can do that on your own, too, by going to his website. I'm talking about Dr. Michael Margolis, and the website is mydentistaz.com. Just go onto the website, scroll down to the bottom of the opening page, and bring that chart up, and you might be able to match some things going on with your own body based on root canals and cavitations found on certain tooth numbers. There's 32 teeth total, and by just looking in a mirror, you probably can figure out what the number of the tooth is by looking at that chart and then looking into the mirror. But I say it'd be an interesting foray to begin to make some sense, because as to whether or not one should have their root canal extracted, because this is the problem. Remember, when you get a root canal tooth, by the time you've left the dentist office on that day, that is now a dead tooth. They bore that thing out. They put absolute alcohol in the drilled out root that they have opened up, and then upon immediate contact with that absolute alcohol, the nerves are killed. The tooth is dead. They plug up the hole with gutta percha, some other product, and then put a cap on top of it. From the outside, this thing was a pearly white. It allows you great mastication capabilities. But, and here's the point that Dr. Margolis made, it's dead. And it's the only procedure done in all of medicine and dentistry that allows a dead piece of material to be retained within the body. Any other surgery that's done, any other place in the body where it is done, you always remove that structure, that organ. You don't let something dead in body cavities to putrefy. But in a root canal tooth, that's what you do. And the putrefaction process, although it's slow, is provoked by bacteria that show up the next day to start digesting that material. It'll take over 300 years to fully digest teeth. That's how resistant enamel is, but digested it will, and a subclinical infection ensues, which can lead to a heck of a lot of problems on whatever organs are found on that meridian. So I bring that to your attention. Please go to the chart if you have any issues. In this particular woman's case, it's now clear she must have that tooth removed. And I believe upon removal, she's going to have great return to normal function. Now, there's one other thing I want to talk about with respect to Dr. Margolis. I'll get back with it. We do have a knock on the door. Come on in the store. Hello and welcome aboard. What's on your mind? Go right ahead.
Hi, Dr. Courtney.
Hi.
Just wanted to say that Dr. Margolis was excellent.
Wasn't he great?
I mean, that was the quickest hour. It really flew by.
It was over before I knew it, too, yes.
He spoke very, easy to understand, and but, very knowledgeable, obviously. But did you say that Meridian chart is on his website?
Yeah, his website is mydentistaz.com. And on the opening page, just scroll down toward the bottom, and you'll see a representation of the mouth, the upper and lower jaw, with all the teeth on it. Click there, and that takes you to an action chart, an interactive chart, where you pick the tooth and click on the tooth, and then a pop menu comes up describing all of the organs and all the body tissues that are involved with that tooth at that meridian. And in the case that I described with a young lady in my office yesterday that had everything going on right-sided, her mouth just dropped. And sort of mine did too, because we just knew once we saw that tooth has got to come out. And I believe once it's out, as he described with the 11-year-old girl, with the medical problems, 30 seconds after he corrected the problem, her issues left. Well, I believe the same thing is going to happen with this young lady.
Oh, so her tooth, was it on the same side that she had the problem?
Yeah.
Oh, I thought it was the opposite. Like if you had a tooth problem, like
oh no,
the periodontal ligament or problem that was affected that was on the right, that you would manifest it in bodily parts on your left.
All right, you have taken a neurological fact and you have transposed it to dental, and you can't do that.
Okay.
So when it comes to nerves now, there's the right side of the brain controls the left side of the body and all the structures there. That is a fact. That's true. But in the case of dentistry, the pathology is ipsilateral. That's a big word. That means on the same side. So the young lady had all these symptoms on the right. Her root canal, the only one she had, was on the right. It was tooth number 30, and it matched up perfectly. Wherever you may have a possible cavitation, which means you had a previously extracted tooth, or you have a root canal, you can do the same thing that we did and see if you could match any symptoms up to that.
Okay. And honestly, why do dentists still do root canals? Because it just harbors the infection, could harbor the infection, and then you end up having, like 9 times out of 10, you have to pull the tooth anyway.
Well, you say that, and intuitively, you and I both think, why would you leave something dead in? But I can tell you, after speaking to as many dentists as I have, they don't look at it that way. They look at this as saving a tooth. When they look at this on an x-ray, that root canal tooth that sticks out like a sore thumb, they say, now look at that tooth there. That's a perfectly healthy tooth. It's dead. I don't know how they can make that statement. They say it's a perfectly healthy tooth. Why would I ever want to extract a perfectly healthy tooth? Look, it's a disconnect you cannot combat with any arguments, so you just give it up. And you either, as a dentist, appear to understand how logically that doesn't even make sense, and if you do, you're able to do the work that I need for you to do, and if not, I don't even go there, because the logic, they cannot see the same logic that you and I do.
Okay. And the other question I had was, at the very end, the dentist talked about a website that you can go on to see about any biological dentists in your area.
Yeah.
What was that website?
You know what? I
I missed it.
I did too. I think I normally try to. I actually wrote it down, and I got so many little pieces of paper on my desk right now.
If you could mention it maybe at another.
I'm gonna find it because yeah, there are a listing of biological dentists. I think in the Pittsburgh area, I almost can give you the list blindfolded. I mean, there's so few of them out there. I know where they are. I know them because patients have come to me and they've reported how their dentist has managed them, and I could tell by the management that they were correctly trained, and there's so few of them, at least in our area. I would like to see the list to see if there's other claims made that they're biological dentists, but biological dentists don't do root canals. Biological dentists that remove mercury amalgam fillings do so with the Huggins protocol, and that's very protective of a patient. So they got to follow certain rules, and they just can't hang a shingle out and call themselves biological because it won't. In many cases,
yeah, I've kind of found out that in our area there are some that claim to be like holistic dentists, and they're not.
They're not, and that's a very good point. They are not. And so I think I have a pretty good beat on most of them. So call me and I'll be happy to give you some recommendations, okay?
Okay, can I make one more question?
Absolutely.
And this is something that I just don't know what the cause of it is. When someone says that you have like a buildup of lactic acid in your body, I know some people who exercise a lot get it, but I don't exercise a lot. But just wanted to know, what causes excess lactic buildup? Can it be caused by your kidneys malfunctioning, and could it be excess calcium in your body?
Lactic acid is a normal byproduct of the metabolism of oxygen with foodstuffs everywhere in the body. Lactic acid is expected in a human being, and if he over-exercise, if he is involved with vigorous activity, going to make more lactic acid. Now, their ability, meaning the individual's ability, to clear out the lactic acid and return to normal basal conditions where the lactic acid has been removed and now the tissue is able to function without any encumbrances or any hindrances, well, that is a testimony to how healthy somebody is or how in shape somebody is. But as far as lactic acid, Lance Armstrong, while pedaling over the Alps, makes as much lactic acid as you and I might do on a walk around the block, but nonetheless, he's able to clear his out and get back to basal conditions a little quicker than you and I. But the fact that he makes it and makes it in the same quantities as you and I do isn't what's in dispute. The disputed issue is how well can you clear it? And that separates, let's say, the men from the boys.
So if my kidneys are like functioning, actually pretty low because of the diabetes, would it be safe to say that I probably have lactic acid buildup?
Well, the kidneys clear out nitrogenous wastes. So yes, there are nitrogen byproducts that come from the metabolism of foods and fats and carbs. So I would have to say that you are impaired if your kidneys or your lungs or your skin, if you can't sweat, every route of excretion, if it isn't functioning optimally, plays a role in your ability to restore lactic acid levels to their bare minimum. So yes, I think the answer to that question is absolutely yes.
Okay, and one more question. Didn't lymphatic drainage help that?
Lymphatic drainage are the larger waste products. The smaller ones are picked up by the venous system, but larger waste products are picked up by the lymphatic system, and lactic acid wouldn't necessarily be one of those because they are biochemically, the molecules are so tiny, the veins can pick those up. The lymphatic system isn't necessary to rid an area of lactic acid.
Okay.
Okay?
All right, thank you.
All right, great questions. Thank you very much. And I agree with him on Dr. Margolis. He was outstanding. Should mention one other thing that he brought to my attention that I did not know. Turned out later on in the day I had a discussion with my own dentist, and we were talking about the materials. One big change which has occurred, and this has a direct relationship to the issue of a root canal tooth, because literally the only way that you can get back to a healthy situation is the tooth must be removed. And the great Hal Huggins, who is attributed with making these findings way back in 1970, it was Dr. Hal Huggins, a dentist, and really don't know what state he was operating in at the time, but he wrote the first books on all that we now know and consider to be common knowledge about the mercury amalgam being so toxic, how root canals are so devastating, and how a cavitation, he invented the word, by the way. It was Dr. Hal Huggins who invented the word cavitation, which is the pathological result of a extracted tooth that doesn't remove the periodontal ligament, and the ligament now decays through the assistance of anaerobic bacteria, and that leads to all sorts of carved out, eroded areas within bone called a cavitation. And so that's the great Hal Huggins. And in the days of Hal, Hal got as far as being able to tell you that when it comes to replacing amalgam fillings, there are composite materials. There absolutely were. And there's a testing agency called Clifford Testing, located in Colorado Springs, that allows a doctor such as myself to set a blood specimen off, and your blood specimen is brought into contact with all, I'm going to say 200-300, maybe even more, of the composite materials to find out which the best fit for you. What Hal did say, and I think we have a change. Hal said that there was no really safe implantable material. Implants have made a meteoric set of improvements so that now there actually are materials that can be withheld by the jaw and not cause any harm. The material that came out in our discussion with Dr. Margolis, because I asked him specifically, you do implants? He says yes. Of course, when you remove the tooth, a lot of patients now don't want crowns and bridges. They want something very firm. They want a tooth put back in place. And implants have improved so much, and the materials have improved so much, that biological dentists can do implants with a material he claims which is the best, called zirconium oxide. In my discussion with a dentist yesterday, yes, he's very familiar with, as all dentists would be, familiar with zirconium oxide, because that's actually a material that you can have as a composite too. So I think I wanted to mention the fact that there is the implantation route for those of you who have root canals and are really concerned about, geez, if I take care of the root canal and I get the tooth pulled, I don't really want like a gap there. I don't want a space in between two teeth. And I really don't like the idea of bridges or crowns. Well, it looks as though dental science has now come up to meet what you require, which is the ability to actually do an implanted tooth that is safe, because the materials are so good now that they actually are able to be implanted without causing you any physical harm. And we'll let it go with that. Okay, going to take a short break. During the break, I invite you to come on aboard if you'd have a mind to do so by dialing us up at 412-825-6262. That's 412-825-6262. Listen for a knock on the door. I'm going to be talking about Neo 40 when we return. Neo 40, another great product we launched this month. Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Here on a Friday morning, now, get 'em up, out-of-town version of the show. Our guest, Dr. Jimmy Barber, was unable to make it today for whatever reason. I really don't know. We've switched gears, as you can tell by now. I'm bringing you a couple of points that I think I really wanted to make anyway, and allowing you to come on in and make the points that you'd like to make. You do that by dialing us up at 412-825-6262. That's 412-825-6262. And you knock on the door, and we let you in the store. And guess what? Come on in. The door is open. What's on your mind? Hello.
Good morning, Dr. Courtney.
Hello.
Hey, it's always fun when several things that you bring up tie together. And when you finally mentioned the Neo 40, I had to call in.
Oh, you did? Well, what would you like to share with us, David?
Some of that.
Huh?
The nitric oxide. I was kind of excited about that product.
Oh, yeah, it's great. The point I was going to make, we might as well start it with you, David, because I believe the neat thing about this Neo 40, besides the fact there's actually a product that can increase nitric oxide on the spot, is these testing sticks now. I say, and I was going to make the invitation to all my listeners. I now make it to you. I'm speaking to you on the phone. Is come on in the office if you're here for any reason, and state you'd like to test your nitric oxide. We'll dip it. And I would say when you come in on the day that you're going to be seeing me, ladies and gentlemen, don't brush your teeth that day. I know it may be a little rough, but don't come in without having eaten anything. Don't brush your teeth. For sure, don't use any mouthwash or anything like that because they interfere with your ability to have your nitric oxide level tested. But I say everybody should get tested to find out what your baseline nitric oxide level is. And then I'm going to give you a couple of these Neo 40 lozenges to suck on. And 90 minutes later, we're going to check it again. And what you're going to see is, David, that you'll go from wherever you are. And by the way, you may have a very healthy nitric oxide level. I don't know. The testing strips will reveal that. But if you had a very putrid nitric oxide level, 90 minutes later after those lozenges, you're not going to have a putrid level anymore. And that's why we can put people on this product called Neo 40 and literally maintain a nitric oxide level that's completely compatible with optimal vasodilatation. Make my point?
Yeah, I think it's an exciting product, especially for guys who have been on Viagra. They're looking for alternatives. The neat tie-in with that was reading from Jonathan Wright that another way, of course, most people have heard of using arginine to boost that nitric oxide.
L-arginine, yes.
Well, there's another amino acid.
Citrulline.
Citrulline.
Citrulline, right?
Yeah, it does it twice as good. And I remember citrulline from years ago, the company that sold Fluorostar, the Saccharomyces boulardii probiotic.
Yes.
They used to have two other products. One was Ornidex and Citrodex. And the Citrodex was citrulline. And I remember they sold it, and how they explained it is it helped the lactic acid to clear out of your system much faster. It was just an interesting time with Kathy's call and the Neo 40, you mentioned that, and the nitric oxide. Every guy out there ought to be pretty excited about that.
Absolutely. This product, by the way, and they have two versions. They have a standard version that you don't need a doctor. You can actually order this stuff and not even see a doctor. And then they have a professional level where the dosage is higher. And that's the level we carry here in the office. And you can only get that through a doctor. But nonetheless, I'd like to test to find out. I mean, the test is free. Just come on in. If you're listening to us talk about this right now, if you're coming to see me for another reason, just make sure that you don't brush the teeth, don't have a meal that morning, and stay away from the mouthwashes. And if I get that kind of cooperation, the Neo 40 testing, the nitric oxide testing, will be extremely valid. And then we're going to give you a trial of the Neo 40, and you're going to see that your nitric oxide levels are going to be reestablished within 90 minutes. And the goal is to put people on a regime allowing them to test at home and come up with the right dosing, that over time the nitric oxide level never drops. What a great thing to be able to do.
Oh, the health benefits are just so incredible.
Oh, and every disease, too. Now, interestingly, you mentioned the Viagra issue. You know, I've got a couple, no, not a couple. I've had a freaking number of my male patients say to me, you know, I was using Viagra. It worked so wonderful for a while, and now it doesn't work anymore. And the point to make is you can't have a nitric oxide deficit and think that Viagra is going to be able to rescue you to maintaining an erection if your baseline nitric oxide level hasn't been sufficiently maintained. So for people who have difficulty even using Viagra, the only way to rescue yourself now is you've got to get your baseline nitric oxide level up. And then when you need the Viagra, you'll be able to get the benefit. It will actually work as it's supposed to because it's not starting from a deficit. The nitric oxide level is already up in a range that's normal, and whenever you supply the Viagra, it takes it to levels above normal, and particularly you get pelvic congestion and penile erection. There is a great way for those men out there who may have had difficulty with erections to make certain that they can get the benefit from things like Viagra and the like. So anyway, that's...
Actually, so does Viagra work for like an inhibitor? It keeps the nitric oxide from breaking down or being used up?
Exactly. It works on a
blocker of some sort?
That's right. It works on a completely different level. So you've got to have your own nitric oxide innately if Viagra is to do the work. And if you don't, and I can tell you, testing, and not many, at this point, maybe 15 or 20 of my patients, but I'd have to say 80% of them, 80% of my patients, and I'm talking about gentlemen in their, 50s and beyond, have a very pale reading. They do have nitric oxide deficits, and we're on our way to get them repaired so that they have no deficit, and they're going to benefit cardiovascularly, but they're going to benefit in every other organ in the body because every bit of vasodilatation that occurs helps whatever organ the blood vessels are found in. Heart, kidney, lung.
Follow up on the liposome issue that we've been discussing.
The liposomal.
Turning other things besides vitamin C.
Well,
liposome.
We're using lecithin, and we got a form of lecithin, but that's already a fat product. That's literally what allows you to take the vitamin C and make it liposomal. But what other products were we talking about that you think you'd like to do that with?
Well, it turns out it's already been done. I did doing some research on it and looking for liposomal recipes, and sure enough, one of the greats of alternative medicine has come up, and it's the Lyme disease doctor, Dietrich Klinghardt.
Oh, Dietrich, yes, Neurotherapy.
He has a special formulation for people with Lyme disease, and he makes it liposomal. Of course, he uses C in that, but he also puts things like artemisinin in and different herbs that are anti-parasitical, antimicrobial, and he makes it into a liposomal formula. Really, if you look up, just type in liposome recipes or type in Dietrich Klinghardt Lyme liposomal recipe, that would get you there.
I will take a look, David. Thanks for bringing it to my attention. I was unaware.
You bet, Doc.
Okay. There you have it. The great Dave Fish, always with wonderful input, folks. Here we are on a Friday. It is a Get 'em Up Out of Town version of the show. You dial us up at 412-825-6262. We let you come on in the store. And by the way, we've had a knock. Come on in the store. Hello, welcome aboard. What's on your mind? Go right ahead.
Good morning. This is Dorothy. I was calling to give you a testimony about the eye drops.
Oh, please go right ahead, Dorothy. What are you talking about? The cataract eye drops?
Yes.
Oh, let our listeners know how well they're working for you, if they are.
Well, I'm going to have my exam today with Dr. Lisa, and I will be able to confirm what I'm going to tell you.
Okay.
Previously, I had trouble threading a needle to sew, and I'm a home economist and like to do things with a sewing machine.
Mm-hmm.
take me forever to get the needle threaded. The other day when I tried it on the first try, another time was only the second time that I tried, and it went through. So my vision is improved considerably by my opinion.
Well, in actuality, and I'm so happy you're going to see Dr. Lisa, it really is going to be your opinion that counts. Now, I'd love to hear that Dr. Lisa, as she looks into the lens of your eye with the ophthalmoscope, agrees that from what you saw last time, there is a change, but you're going to go with what you feel is telling you that these drops are working on your behalf. You're seeing better than you had before. You're able to thread the needles that you couldn't before, and I'd just like to hear that objectively Dr. Lisa can confirm why it is that you're seeing so well, because I'd like to think that there's a documentation that was able to be, we can make a record of it. An eye doctor saw this, patient says this, the two jive. I'm hoping that's where this thing takes us. And the truest answer to the query is, it doesn't matter what the eye doctor says in a way, it only matters what you say. Your vision improves, where all systems go. So good luck today.
Well, thank you very much, and I enjoy listening to your program every time that I can remember to put it on.
Okay, well, thanks on listening, and stay tuned.
Thank you. Bye.
Okay, absolutely wonderful. Yeah, the cataract eye drop program, that's that mixture of glutathione, vitamin C, and DMSO that we have to get compounded, and we put them on a 3-month glide path to see if in 3 months they can improve their vision by dissolving the toxic substances that have collected on the lens. If they can do that, they'll be able to avoid cataract surgery. So we say at least a 3-month trial before you go off and get that surgery, and it can go up to 6 months if you wanted to before you have to make a decision such as that. The bottom line is you don't suffer in any way except with battling what might be disturbed vision for a while, but at the end of it all, let's say that you did this for 3 months, or you did it for 6 months. At the end of that time, you didn't feel, and the optometrist didn't feel that you benefited in any way. And that's the point, then, that you should consent to have the surgery, and with the surgery, you will have suffered no ill effects. Your vision will be corrected as it would have been had you gone and got the surgery on day one. Because once that old lens is taken out and the artificial lens put in, the clarity of vision is restored, and it should be restored immediately. You just want to prevent the need for any surgery whenever you can. Hey, we got a knock on the door. Come on in the store. Hello, and welcome aboard. What's on your mind?
Good morning, Dr. Courtney.
Hello.
Hi, Dr. Courtney.
Hi.
I want to ask you first quickly one thing, and then I just want to ask you another question. First of all, and maybe I should call Kim, your office manager. Do you know of someone in Pittsburgh that does colonic irrigation? I know there's a man named Alan, but I can't find his phone number or name on my...
Yeah, there actually are a couple that I've had recommended, and when I have referred, I've referred to only one or two. There may be many more, but the ones that I've referred out to, and the name, we have the name here. Yes, call to get the actual name of the individual. We'll be happy to refer you on.
I'll call Kim then at your office.
Mm-hmm.
Okay, and then let me ask you another question, please. I've had a series of chemo and radiation, chemo by pills, and there's a surgeon waiting because surgery may be needed, although some cancer may have melted. There was a hard mass of cancer up in my rectum, because of which I got a colostomy bag and some chemo and radiation. Now, I'm done with the chemo and radiation, but in order for them to know what's up in there, what has melted or not, what is still hard, what is needed, the doctors want to do a CAT scan. But I don't want any more CAT scans.
Sure.
I've had 3 of my brain, and they've had delirious effects.
Mm-hmm.
Do you know of some other way, in your opinion?
Oh, absolutely. I mean, I have made all my doctors, I put them on notice that we no longer do CAT scans as far as I'm concerned.
Oh, boy.
And the only study that I'll allow them to do is an MRI.
Oh.
They fuss and they hiss and they go, don't you fuss. Don't tell me that you can't use an MRI. It's just you're not used to using the MRI. And I'm telling you, boys, you better chum up to the new technologies because the pictures are as good as they are with a CT scan without the exposure to the X-ray. So let the boys and girls know that you aren't having any more CAT scans.
No, I don't want any more.
Okay, and they have to grow up and use the technologies that are available to them. The CAT scan technology is a 1970 and 1980 technology.
Oh.
The MRI is where we are today. Okay?
Yeah. Thank you, Dr. Courtney.
Absolutely. You tell them, Teresa. Okay. Thank you very much. We wish her the best of luck. So here we are in that Gun Lab show, Gun Lab portion of the show, where you can come on in at any moment and set the agenda. The number to do that, as you should know by now, is 412-825-6262. That's 412-825-6262. I don't believe there's no other knock at the door. Anybody out there? Hello? I don't think so. No. Okay. One of the other things I wanted to get off my chest, we are getting barraged with interest from you, the listeners, on the concept of ozone therapy. And I just thought I'd share a couple things with you. I'm very pleased to be able to help many of you out. Whether or not you have a systemic disorder, literally requiring you to benefit from major auto chemotherapy alone, or whether or not you have a pain problem, a localized problem, for which you're interested in doing prolozone. The results up to this point have been amazing, especially when it comes to these pain problems. When I see people and they've had pain for 20 and 30 years plus, and then after one treatment, their pain is dropping 50 and 60% with the first treatment. I haven't even gotten to the second or third treatment yet, because we haven't been doing it that long to say that we've done a full, and I consider 4 treatments to be the full regime. So I'll keep you posted, folks. I want to mention about the common thread of pathology that ozone meets, which allows it to be the game changer for no matter what the disease is. Hopefully get that opportunity before the time expires today, but we do have a knock on the door. Hello, come on in. Welcome in the store. Go right ahead.
Good morning, Dr. Courtney.
Hello.
I have been listening to your show. Very good. I do. If you want a quick moment here, I have the websites for that biological dentist.
Oh, thank you. Tell us.
Number one, I have. These are all letters.
Yeah, that's right. There were a bunch of letters.
Yeah. And they're .orgs, okay?
Okay.
He gave out, I have I, A, B, B is in boy, D is in dog, and then M. Okay, .org, that was one. The other one was IAO, M is in Mary, and T.org. And then he had mentioned, I guess you could just put in holistic dental.
Oh, I'm going to...
Those were the 3 references that I noted.
Well, thank you. I remember there were a bunch of letters now. I had forgotten that. They are the letters I remember who talked about. And there should be a list of biological dentists there. I'm going to check it out because I'm interested to find out who claims to be a biological dentist in my area.
May I make one other quick comment here on this Neo 40? I'm a little confused. Besides the citrulline, the Dr. Margolis had mentioned one of the B complex, I believe.
Yeah,
but I came across a formula, and it referenced beetroot and hawthorn and vitamin C.
Vitamin B12. I'm looking at the back of a box of the stuff right now.
Okay.
And so B12, folate, vitamin C, yes, nice healthy doses of all those. But the proprietary blend, the nitric oxide blend, beetroot powder. There you go.
Okay.
Hawthorn berry extract, and there's L-citrulline and sodium nitrite. This is the proprietary blend, so you're going to get the ingredients. You're just not going to get the proportions, and the total milligrams on all those are 425 milligrams, at least with this professional dosing, as compared to the dose that doesn't require the doctors to be involved. So that's the name of the stuff that's in there, and I love the idea of the testing strips. Anytime you can get an instantaneous visual reference to the status of whatever it is. I mean, the litmus paper gave us pH stuff immediately. Well,
I agree. Yeah.
These test strips make this very slick and sophisticated, so as to let the person know that they've corrected a problem. When they see that their morning nitric oxide levels are maintained at a higher level and the color changes are indicative of a good range, they feel good about themselves. By the way, they'll be seeing their blood pressure. I'm using this really to help out people who are trying to get off of blood pressure medicines or not ever start them. And I think Neo 40 is going to afford me, along with magnesium and additional citrulline, because that's what Dr. Chris Miletus said needed to be rounding out your whole supplemental regime. Generous supplies of magnesium.
Yeah, I'm on that page, and that's why I'm so interested in this. I will pass on to you. I came across the creator of this formula, apparently.
Brian Nathan.
It is Nathan Byron.
Nathan Bryan. That's his name. Okay.
Yes, he's a professor of molecular medicine at the University of Texas. I wonder if maybe you could convince him to be a guest someday.
I actually talked to Nathan. He consented to come on. I promised to bring him.
Excellent day.
Okay, there we go, folks. Thank you. Folks, bongos are signaling our time out of here. Hope you have a wonderful weekend. Don't forget, on Monday, Dr. Mark Starr, thyroid disease a la Rhoda Barnes. Bye now.